Good morning, everyone. Appreciate all of you joining us here today for what is another step in our region's efforts to try and do better, to tackle the challenges we face between substance abuse, mental health injury and illness, along with confronting the reality of homelessness and the very real need for action and to see progress to help those who are struggling in our community. And today we are doing just that. Today is an example of what happens when our county and our city come together alongside our nonprofit community and our service providers. And when we say we have to move forward and we have to move forward aggressively, and the launch of the impact of our Behavioral Health Impact Fund, I think is a model that we will continue to strive and replicate to make sure that we continue to do better. Since joining the Board of Supervisors 2 years ago, building a better way to deliver behavioral health services has been my highest priority, and our county is moving. Some of the single largest budget increases in our county's history have been in the recent years in areas in health and human services, and in particular in behavioral health. In this year's proposed county budget, we have an unprecedented $813 million for services and facilities in the behavioral health space. But it isn't just about money. It isn't just about throwing money at a problem. You got to have good partners. And you have to invest in programs that you know can work. And since the election of Mayor Gloria, who came in with the tremendous energy and drive to say, look, let's get to work and let's get this done, our city and our county government have never been more closely aligned than under the leadership of Mayor Gloria and our present Board of Supervisors. And we are committed to tackling these problems, not just here in the city of San Diego where we are, but a recognition this is a regional problem and a regional challenge, but there also exist regional opportunities. And so today we are here at La Maestra Community Health Services to announce that along with 4 other service providers, they are the recipients of the first $5 million of the Behavioral Health Impact Fund. The other $20 million will be allocated in the coming months. And I believe that projects like we're funding here today will show what can happen again when we work together. It will show when we have a commitment to investing in things that provide long-term solutions, the ability for someone to transform their life, to get it back on track. There will be a strong desire to see the Behavioral Health Impact Fund continue to be replenished and this model to continue to work. Now, how did we get to the point of the Behavioral Health Impact Fund? Where did this idea come from? Is a question I get a lot. And it started 2 years ago. It started by meeting with service providers when I would go out to a program that worked and I would say, hey, this works. Why don't you do more of it? You've got 10 beds that are transforming lives. Why don't you have 20 beds that are transforming lives? Because a lot of these programs, they have state or federal funding sources to provide for the services. But there's no funding available to increase the capacity. There's no funding to invest in bringing on more beds and expanding a building, acquiring a building, renovating a building. There's often no funds that are available to buy the equipment and stuff that you need in order to increase the amount of services you provide. Once you get that, then you can draw down more state and federal funds. And so it hit me that what we needed was a behavioral health impact fund to make that one-time infusion, to add beds, to add rooms, or to acquire equipment. And then once we do that, that entity has the ability to draw down funds to continue those services long into the future. And at the time, the city of San Diego and the county of San Diego were involved in a lawsuit over excess redevelopment funds. And I went to the mayor and I said, look, we've got $25 million in dispute between the two of us. And if the county wins the lawsuit, we ought to spend the $25 million on this. And if the city wins the lawsuit, you ought to spend the $25 million on this. And so we resolved our portion of the lawsuit and said it doesn't matter who wins, the $25 million will go into the Behavioral Health Impact Fund. And we immediately put those funds on the street. And today we're awarding the first $5 million of $25 million to do this. And I want to commend La Maestra. We're here at their location in City Heights. I live right around the corner. I had a 4-minute commute to get here this morning. And this property will be transformed into 21 units of transitional housing. 21 units of transitional housing will be brought online. 30 individuals annually will be provided whole person mental health and drug treatment services with integrated health and wellness care. And in a minute, you're going to hear from the folks on the ground here, and you're going to see firsthand the lives that get transformed by this program. You're going to hear from a couple gentlemen who went through a rough patch in life, no different than anyone else goes through a rough patch in life. But if you go through a rough patch in life with a physical injury, well, we get you in the hospital and we get you on a rehab program and we get you some physical therapy and we get you some job training to repurpose that. You blew out your back or your hip. But somehow when it comes to an injury right here, no different than anywhere else, it's different. But these gentlemen will show you what's possible to not only transform your life, but become a leader in this field and do it. And so we know what these 21 rooms can do, and you're going to see from that in a minute. And I appreciate so much Zara, our CEO here, and the entire team, and what they do on site and what is potential as we move forward. We're also, Community Research Foundation is a recipient of one of the grants out of the initial $5 million. They'll be using their allocation to purchase vehicles to transport individuals staying at 3 crisis residential treatment locations in the city of San Diego to medical appointments, to housing and other healthcare needs. That's a part of making these programs work. Stepping Stone of San Diego, another awardee. They're going to create additional outdoor space and an 8-passenger minivan to again be able to expand transportation to and from medical appointments to draw down more of those services. Sharp Healthcare Foundation is going to be able to purchase 65 licenses to implement behavioral health services via telehealth. COVID has shown us something we knew for a while, that a lot of these services can be provided remotely. You can reach more people in a quicker and better way. And Jewish Family Services will use the money again to purchase technology to increase that telehealth access to the services. These 5 projects, with La Maestra being the largest, are exactly the type of investment and increase in service opportunities we envisioned when we launched this fund. It adds capacity, it adds the right type of services in the right place, and I could not be more excited about the impact of the Behavioral Health Impact Fund. So grateful for the partnership of the City of San Diego, really grateful for everything Mayor Gloria has done, and then so deeply appreciative of the hard work that often goes unseen by the folks that are out there doing it every day. These are your counselors, your clinicians, your outreach workers. These are the folks that are tracking the money and paying the bills and making it all happen. And with more help and more support, we can reach more lives and have a positive impact in the city of San Diego and throughout our region. And with that, it's my great pleasure to introduce my friend, Mayor Gloria. We were on the phone almost pretty much every single day talking about, hey, we got to do this, we got to do that. We know people want to see action. We have a desire to move quickly, and I think our city and county government together, we're going to be in for years of sustained progress, and I think the residents of San Diego County will benefit, particularly from the leadership of Mayor Gloria. Mayor, thank you for joining us.
Thank you, Mr. Chairman. Great to be here this morning. It's always great to be in City Heights. You know, my mom grew up on Wilson Avenue, just a few blocks from here. She went to Edison Elementary. We have long and deep roots in this community, and to come back time and again and see its progress. It's undeniable progress. Not as fast as many of us would want, but it's certainly progress in the right direction. And one of the groups that have been a true driver of that change has been La Maestra. So to Zara Masalian and the entire team here at La Maestra, thank you for what you all do, for your presence here at the clinic for so many years now, to its expansion down Fairmont. I know when La Maestra is involved, I know the community is getting served, is being served well, and I thank all of you who are part of the La Maestra family and team here. The news today is about a $5 million allocation of funds. But I think, and the news today is also about 21 units of housing. We all know any increase in housing in San Diego is something for celebration. We have far too little of it for as much demand as there is. And so that, understandably, is the headline. But as you heard our chairman talking just a moment ago, I think the real news here today is about a city-county collaboration that is intended to better serve the people of San Diego. You know, for many, many years, there has been, I think it's fair to say, a bit of a tension between the city and the county. And the losers in that arrangement have been the taxpayers of this community, who have watched homelessness skyrocket, low utilization of social programs, a growing gap between the haves and the have-nots. And that really can sustain itself. It cannot go on. Under the leadership of Chairman Fletcher and with my administration, those days are over. And at a time when we see rapidly increasing amounts of mental illness in our community, this announcement cannot come at a better time. Because the fact of the matter is that San Diegans are hurting. We as a community have long held a mental health crisis. Yet our culture is one where we don't talk about it a lot, not in front of these microphones. We keep it pushed back and in the backs of our minds, in the backs of our homes, in the backs of our family trees. We don't talk about it. And by not talking about it, the problem gets worse. And when government doesn't work together to solve it, the problem becomes a crisis. What you've heard from the chairman and myself is that we will work collaboratively. We'll stop suing each other and instead take the money and put it into neighborhoods like City Heights so that more people can get help. And right now, after more than a year of a pandemic that has hurt people's physical health, we know as we emerge from our homes after sheltering to keep ourselves safe, many folks are going to emerge with a deeper acuity of mental health needs. And so that's why I'm really proud to stand here with Chairman Fletcher, with La Maestra, with so many community members to say that we understand the need is there and we are going to step it up to make sure that as folks step forward and bravely say, I need help, that there'll be a hand there to help them. And so this Behavioral Health Fund, a city-county collaboration, something you haven't seen a lot in the past, is investing $5 million today, and we got $20 million more to go to make sure that programs like La Maestra can actually have the programs that are working, you're going to hear about in just a minute, and then make them be able to serve even more people. Great groups like Stepping Stone, just a few blocks from here, who I know friends who have personally had their lives saved because of that particular program, are going to be able to serve more people effectively. This is good news, everybody. That is the headline. We're going to work together as best as possible to use all of our limited resources to help as many people as we absolutely possibly can. And at a time of crisis and a time of pandemic, this is the exact right time. I want to thank Chairman Fletcher for his spirit of cooperation, of our mutual friendship, of our desire to say, I don't care who gets the credit, let's just get the job done. That kind of collaboration and relationship is something that you have long deserved. Now you're getting it. And I want to thank his colleagues on the Board of Supervisors, as well as my colleagues on the San Diego City Council. We are in lockstep in saying that we have to work together. Our homelessness crisis, our mental health crisis, our behavioral health crisis absolutely demands it of us. The city has never had a mental health department. But as I talk to people across this city, in the middle of a pandemic and a recession, this is the issue they talk to me the most about. People are upset about the rising number of unsheltered people in our community. And we recognize that many of them live on our streets because of behavioral health issues, because of substance abuse issues, because of mental illness issues. So while we may not have a mental health mental health department, you will never hear this mayor say, this is not my problem, go see the county. We will work collaboratively with our partners at the county to make sure that we're doing what must be done to preserve the mental health of this community. And so I want to just wrap up by saying that, again, I see this as the first of many steps, that hope is out there, that if we can tackle and work together on mental health, we can surely work together on homelessness. We can surely work together on making sure our young people are cared for. We can surely work together and make sure our seniors, our disabled population are well cared for. The city and the county working together, we can make a stronger case in Sacramento and Washington, D.C. to get our fair share of state and federal resources, not to let L.A. or San Francisco get those dollars, bring them right here to San Diego. It's a new day in this community. But the city and the county are under new leadership. And today is bearing the fruits of that leadership, of that change, and you all are the beneficiaries. I'm grateful to La Maestra for being a quality nonprofit that we can invest in with confidence. For the services they provide, you're going to hear the benefits of those momentarily. And I'm certainly grateful for my colleague, Nathan Fletcher, who has brought this renewed spirit of cooperation that is going to help us get the job done. I'm going to wrap up there because I realize I'm standing in the shade and you're standing in the sun. But I actually interpret your presence here as a vindication of the fact that we must work together, that we must prioritize mental health in this community, and that we must drive change, break the status quo, get more done for the people of this great city. Know that you have a champion in that, and myself and in Chairman Fletcher. Thank you all very much.
Thank you, Mayor. Next, I want to invite Dr. Zara Maselian, the president and CEO of La Maestra. She founded this organization 35 years ago to improve access and quality, providing primary and specialty health care, on-site, upstream social services for all individuals, regardless of their ability to pay. Zara is going to share more about the vision along with this new transitional housing project, and we're incredibly fortunate in San Diego to have incredible partners like this to be able to work with. Laura?
Thank you so much. Thank you so much. This is truly an awesome day, a day to celebrate the ability to continue providing services to the most vulnerable in our communities. You know, being here for 35 years has really taught us a lot of lessons. And we as an organization have gone through a lot of challenges, and one has been really forming strong partnerships with our local, county and state and federal agencies that really address the needs of the communities, right? And so we're blessed that we have such a fine partnership between the city and the county of San Diego, and really focusing on taking action. And this project is an example of the action of expanding the transitional housing in City Heights by 21 units and having a wonderful, rooftop garden on top, and next to our other transitional housing that we've been running since 2010, and learning a lot. Like, housing is super important, so is medical. But without mental health services, behavioral health, and all of those social determinants, people aren't going to achieve wellness and well-being, because there's always going to be pieces missing. So, also food scarcity and youth development. And so it's about having all those services and having them seamless to where you have them under one organization, and really participants feel like this is the support system they've been looking for. So many of our populations are marginalized. They feel isolated, especially after COVID, right? And so this is a wonderful integration, a wonderful model, and we know it works because we've already been working it for how many years through La Maestra Circle of Care. So now we're able to offer more. And, it also requires the right staff that are culturally competent so that participants, clients, patients can align with the staff. Why? Not just because they speak the same language and they share, similar values and belief system, but also because they've walked that path already. So you have that trust that's built right away. And patients feel like, wow, I have a support system. I can rely on La Maestra and the staff because they know what I've been through. So I'm going to go to them and ask them for advice. So you keep building these relationships, and also the staff serve as a, real symbol of hope, because people that are coming in with myriad of complex needs, they look at the staff and they say, wow, that person was in my shoes before, and look what they were able to achieve. Well-being, they're happy, they're giving back to the community. So this is what integration brings. It's really the magic of having all of the services, yes, the people need, but it's how you deliver them and who works the services, who delivers those services. So thank you so much, Supervisor Fletcher and Mayor Gloria and the city and county, and we hope to see you back again for our groundbreaking and many other celebrations, including other properties down the street that we could still acquire to expand even further. So thank you so much.
All right, now my favorite part of the program. So when we talk about structurally confronting an issue, that doesn't just mean giving someone a place to stay and be safe and compassionate. That's often a first step. We're talking about getting that person well and getting them a life of purpose and progress and meaning and transforming that opportunity. And we're going to hear from Mark and then Robert as two examples of individuals with lived experience whose lives have been transformed. But this is also a model of what we can do as we expand these services. And in my mind, someone suffering from addiction is no different than someone suffering from diabetes, right? There's a little physical change in your body, sometimes a little imbalance, and you know what? We know how to treat it. And the difference is someone suffering from diabetes is not going to have a shortage of places to go to get care. We got enough places for you to get care. But if you're suffering from addiction, we might not. The other thing is, if you go in to get care for your diabetes one time and they get you on a program, and then a couple of years later you get a little lazy, you kind of forget, we don't go, well, no, you had your one chance, we're not going to help your diabetes anymore. No, we don't do that with diabetes. So we ought not do that with addiction. Someone suffering from bipolar or schizophrenia is no different than someone suffering from high blood pressure. We treat it. We fund it, we staff it, we site it, we treat it, and we give you a pathway to come back. And we know what can happen when we do that right. And Mark, a case manager here at La Maestra, is an example of this. And we're going to hear first from Mark a little bit of his story, and then we're going to hear from Robert a little bit of their story. And I hope that these two stories inspire us all to provide more services and more opportunities like this, because we see what can happen. Mark?
All right, good morning, everyone. First and foremost, I want to say that I was once a person who needed mental health treatment and substance abuse treatment, and now I'm a person that's able to provide support and help to someone who is coming in the doors that needs that as well. I want to thank Zara and La Maestra, Cynthia, all the people that was here when I got here and provided me an opportunity. So when I came here, it wasn't, you know, I was in a position where I needed help. You know, I was able to utilize the house next door and live there, and in my process, I was able to provide support to other members coming out of prison with mental health and addiction, and I was able to watch people grow. And it's like watching a flower grow. You know, it's beautiful to see someone grow and take advantage of opportunities provided to them, right? Because we can throw someone in a house, but until they're ready to utilize the services provided, you know, and utilize that housing, you know, we're not going to be able to help them. But in San Diego County, and I'm going to say this really quick too, you know, when we see someone walking down the street suffering from mental illness, we don't know their story. So we have, you know, try not to be, and I'm speaking for myself, I have to try not to be judgmental of what they've been through, because I don't know. You know, I know my story and how I got to where I needed mental health. You know, I could go on and on about it, but, you know, when I was in that situation, I didn't have the resources I needed. And so I'm a very big advocate of utilizing resources now. So when I talk to the people that come here to change their lives, that come to La Maestra, and let me also say I work with a great group of people. I've seen people shining when there was no light on them, helping people that you would think that no one, like you would see them on the street, and you wouldn't even want to walk by them. I've seen some of my coworkers go up to them and offer their undivided support and help them, you know, give them services, offer them services. So that's first and foremost is an important thing. So we're not going to always shine when the light's on us, right? So we have to shine when no one's looking. In La Maestra, as a team, as a company, we do that here. Like, I am truly blessed to be a part of this and to be able to help people in their time of need, you know, and to work with a great team of mental health providers. And let me correct Mr. Fletcher, I'm a counselor, so just as well as a case manager. I like to be able to, you know, and that's my story. I came here and I'm pursuing my path, so now I'm able to be able to help people suffer what I went through. And also one other thing that he touched on is, you know, with the disease of addiction, we look down on people, right? Like he said, with people suffering from cancer, you know, family members, like, so if you have a family member suffering from cancer and people want to go and give them a get well card and, you know, offer them support and take them to their dialysis, you know, I'll take you to your appointments. But when they're suffering from mental health and disease, they don't want nothing to do with them. They're like, oh, you know, you shouldn't be making this decision. You shouldn't be strung out on this. But we don't know their story. We need to be able to support them. We need to treat mental health and addiction just like if it was cancer, because it's a disease. They call it a disease of addiction, and I just want everyone to know that, you know, support your loved one. If you're watching this and you need help right now, reach out, ask for help, and utilize the resources provided to you. So I don't want to take up too much time, but I do want to say treatment works, and if you're a part of this, you know, be proud of it. I'm very proud of this company, and I look forward to working with La Maestra and the city of San Diego and bettering people's lives to the best of our ability. You know, we are here, and hopefully you guys can, you know, come out and get the support you need. Thank you.
Thank you, Mark. Our final speaker today is Robert Marquez. In 2010, he was referred by San Diego's drug court to La Maestra's transitional housing program. Today, he is a member of their board of directors. He is their food pantry director, responsible for growing their food pantry program from a couple thousand pounds of food to more than 80,000 pounds of food. Robert is another example of how person-centered care can transform lives. Robert?
It's a beautiful day, isn't it? Thank you, Mayor Gloria and Supervisor Fletcher. A little bit more than 10 years ago, I got a phone call that I could move into a room. I was at a point in my life where I was seriously thinking of doing something that wasn't legal to get money so I could live. I have a place to live. I had been invited to Zara's house a couple years before that, so I knew who she was, and I knew that she was working with this couple that I knew about transitional housing, and I thought nothing of it until I needed it. And I came with the clothes on my back, and I was very happy, and I dodged a bullet. I had been one of those guys that was in the revolving door, always going back to prison because of my addiction. A lot of people say, "Oh, you've been to jail?" It was like I was constantly there, you know. So when I arrived, just for planning on having a place to live, I had been told that the crews that we have, the demolition crews, would meet right here in the blue house in the front in the morning. Be there at 7 o'clock if you want. And Dodie, I thank you from the bottom of my heart. He said, "I'll put you to work." And it all started there. I remember busting ass. We would work, you know. And, you know, from there it just started. One day I went to Panera Bread to pick up bread with a friend that knew Zara. And I guess she shared that news with Zara. And next thing I know, Zara's calling me up and said, "I'm going to make you in charge of the food pantry." I was like, I had no idea how to run a food pantry, but I did it, you know. And within that time, she had brought me in literally to start our own laundry service that I have in the back. And I remember telling Zara, "I don't even wash my own clothes." But I remember we just had a washer and a dryer, the kind you have in your house, and we started with that. And after about less than a year, I'd say, Zara bought me some commercial washer, commercial dryers, and now we provide laundry, whether it's lab coats, towels, gowns, to all of the clinics at La Maestra. And I hope I'm saving us some money.
Absolutely. And training other people.
And yes, and I do have people working under me there. We gave jobs to people in the community. During this time, I always tell people, man, I got here toothless and ruthless.
Yeah.
And we used to provide dental service for all the people that were housed here. And so I started going to the dentist. And like I said, I had spent years in prison, so anytime you had a toothache, they yanked the tooth instead of, you know, working on it. And I used to tell people, I've got 9 teeth. 3 of them are in my pocket. You know? And because of the way I live now and being responsible, I can show you a big old grin and they're all mine. I went and got implants. It was something that I always wanted. The other services that were provided to me that literally saved my life. Because of my drug use, I had hepatitis C. That was taken care of here. High blood pressure, they took care of it here. I even saw our dietitian, and I had lost 40 pounds behind it, you know, and took care of my diabetes. And I can't believe how far I've come health-wise and the person I am. Zara was talking about the food pantry and providing food to nearly 400 families a week. And that's my biggest thrill, you know, giving back, because I was always a taker. You know, that's how I lived. And I'm able to hold my head up high, which I never did before, you know. And with that, I'm going to close. I know you guys are hot. And I want to say that I am so proud of the La Maestra team. Zara, thank you for everything. I owe you everything. That's all I got. Thank you.
Hey, let's give it up for Mark and Robert. I told them this earlier. Every day of their life, they're showing a model. As people come in, they're going to look at the two of you and say, you know what? I can do that. And that is a tremendous thing. And because of this city-county partnership, there's a whole lot more people that over the next 20 to 30 years, a long-term investment will become the next Mark and Robert. Thank you, everyone, for joining us here today. I'll quickly ask if members of the media have any quick questions. If not, I know everyone here is available for individual follow-up. So thank you all for being here. Thank you, La Maestra.